Hello, my name is Mamie Allen, and I'm an instructor here at Ultimate Medical Academy. Today in medical terminology, we'll take a closer look at the sensory system, specifically the ears. We'll look at the structures within the ears as well as some combining forms relating to those ear structures. So let's dive in. In our sensory system part 1, we covered the eyes, which are part of our system. But now we move on to discuss the functioning of the ears. So our ears would be our receptor organs for hearing, and their functions would be to receive sound impulses and then transmit those impulses to the brain. Our inner ear will also help with maintaining our balance. Now, some abbreviations you may hear referencing the ears would be Latin forms, AD, which is the abbreviation for oris dexter. Then we have the abbreviation AS, which is for oris sinister. AD would refer to the right ear, whereas AS is referring to the left ear. We also have the terms auditory as well as acoustic. Now, when dealing with the auditory system, this means pertaining to the sense of hearing. The term audit means hearing or a sense of hearing, and ori, that O-R-Y, means pertaining to. In the term acoustic, acoustic would mean pertaining to sound or hearing. Again, acous, that A-C-O-U-S, means hearing or sound, and then the T-I-C, that tick, means pertaining to. Let's take a look at the structures of the ear. We can see here it's divided into three regions. We have our outer ear, the middle ear, and then the inner ear. So starting with the structures of the outer ear, we have the pinna, and this is also referred to as the auricle. And this would be the external part of the ear that we can actually touch and feel. The purpose of the pinna would be to capture sound waves and then transmit those sound waves into the external auditory canal, which you can see here in the center that extends from our external going towards the middle ear. Now, the external auditory canal will transmit sound waves to our eardrum, which is located in the middle ear. Also within this external auditory canal, we have the substance cerumen. And cerumen is the medical term, but an easier term you may be familiar with is earwax. And this would be secreted by ceruminous glands that line the auditory canal. Now, the purpose of the earwax would be to trap small insects, dust, debris, as well as some bacteria that may actually prevent from getting within the inner or middle ear, I should say. Moving on to the middle ear, this would be located between our outer ear and our inner ear, and it too transmits sounds across the space between these two parts. So taking a look at the eardrum, remember the medical term for this would be tympanic membrane. This is located between our outer ear and our middle ear. Some combining forms that you may see referring to our eardrum would be myringo and tympano. Both of these terms mean tympanic membrane. Keep in mind, when sound waves reach our eardrum, our membrane then transmits the sounds by vibrating. Also within the middle ear, we have our auditory ossicles, and these would be the three bones that we see in the middle of the ear. And it consists of the malleus, which is similar to a hammer, the incus, also known as the anvil, and then we have the stapes, and this is also referred to as the stirrup. Now, to help or transmit vibrations, we also have the eustachian tubes, which we call our auditory tubes. The purpose of these auditory tubes is to equalize the air pressure that's within the middle ear with that of the pressure of the outside atmosphere. And then moving on to our inner ear and the structures there, we see would be the oval window. We also have the cochlea, the organ of Corti, and then we have semicircular canals. So if we looked at the oval window, this is located under the base of the stapes, and this is the membrane that actually separates our middle ear from our inner ear. So vibrations enter the inner ear through this structure. We also have the cochlea, and this is that snail-shaped structure of the inner ear, and this is where our sound vibrations are changed into nerve impulses. Located within the cochlea are the cochlear ducts, the organ of the Corti, and then the semicircular canals, as well as our acoustic nerves. Keep in mind, the term cochlea comes from the Greek term which means snail, hence the shape of it itself. Moving on to some normal functioning of the ears, meaning what is its purpose? One would be for air conduction, and air conduction is the process by which sound waves would enter the ear through our pinna and then travel down the external auditory canal until it hits that tympanic membrane or the eardrum. And here it's located between, again, our outer ear and our middle ear. We also have bone conduction, which is also a normal action of the ear. Here, this would occur as our eardrum vibrates, and this vibration causes our auditory ossicles to vibrate too. Now, the vibration of these bones transmits sound waves through the middle ear to the oval window of the inner ear. As in other body systems, we also have specialties related to the ears, or medical specialties relating to the ears. And this would be the physicians who would treat certain conditions of the ear. We start with an audiologist, and this would be one who specializes in the measurement of hearing function and in the rehabilitation of one's hearing impairments or their hearing problems. If we were to break this word down, audi, that A-U-D-I, refers to hearing, and the ologist means a specialist. So audiologist is one who specializes in the functioning of hearing. We also have a speech language pathologist, and you may see this with the abbreviation SLP. And an SLP may be involved in different medical areas, including audiology. These practitioners will help patients who have problems relating to swallowing, speech, and also some communication disorders. Let's now move into some disorders or diseases of our ears. Starting with our outer ear, we have impacted cerumen. So cerumen is a term that we're familiar with, right? Remember, that's meaning earwax. So impacted cerumen would mean an accumulation of earwax that begins to form a solid mass by sticking to the walls of our external auditory canal. When you hear the term impacted, this means lodged or wedged firmly in place. Next, we have otalgia, and otalgia is also known as an earache, and this just means a pain in the ear. If we were to break this term down, the aut or auto would mean ear, and then algia is referring to pain. Otitis is an easy one to define. Simply it means inflammation of the ear. Aut again means ear, and the itis would mean inflammation or the suffix inflammation. Now, the second part of the term will identify the location of the inflammation. For example, if you hear otitis externa, this would be inflammation of the external auditory canal, also known as swimmer's ear. Some other conditions of the outer ear, we have otorrhea. Remember, rhea means discharge, so otorrhea would mean any discharge from the ear. Auto meaning ear, rhea meaning discharge. Now, in rare cases, this could include some leakage of the CSF, which is that cerebrospinal fluid. Then we also have autorrhagia, and this would be any bleeding from the ear. Breaking this term down, auto is meaning ear, and the rhagia refers to bleeding. Now let's take a look at some procedures that are used to diagnose different disorders or diseases, conditions of the ear. We start off with an otoscope, and this would be an instrument used to examine the external ear canal. Also, you may hear pneumatic otoscope, and this has the attachment of a light bulb that's filled with air. Now, during an exam with an otoscope bulb is pressed to visualize whether or not our eardrum is immobile, meaning immovable. This would indicate a possible otitis media. We also have monaural testing, and this would involve the testing of one ear. Breaking this term down, mon means one, the AUR, the R means hearing, and then the suffix of AL means pertaining to. We also have binaural testing, and this would involve both ears, hence the prefix bi. So bin meaning two, R again is meaning hearing, and the all, that AL, is the suffix meaning pertaining to. Now let's take a look at some treatment procedures that are used for our ears and hearing. We have otoplasty, and again, referring to the outer ear, this would be the surgical repair, restoration, or alteration of the pinna, that external part of the ear. So if we were to break this term down, auto means ear, and plasty is meaning surgical repair. You may also hear this referred to as ear pinning, and it's also important to note that it's mostly a cosmetic procedure. Then move on to our middle ear, we have our ear tubes. Now these are tiny ventilating tubes that are placed through the eardrum to provide drainage for fluids and to also relieve any pressure that may build up after childhood ear infections. Some other treatment procedures would be a mastoidectomy, and this would also be of our middle ear. Mastoidectomy would be the surgical removal of our mastoid cells. Mastoid is referring to the mastoid process, and ectomy means surgical removal. This would be a procedure that's used to treat mastoiditis, which means that the mastoid is inflamed. We also have a myringotomy, and this is a small surgical insertion into the eardrum to relieve any pressure that may be from excess pus or fluid, and this creates an opening for the placement of ear tubes. Myring means eardrum, and otomy means surgical incision in two. And then we have our stapedectomy, which is the surgical removal of the top portion of our stapes bone. Remember that bone within the middle ear. And then insertion of a small prosthetic device known as a piston. And this piston will conduct sound vibrations to our inner ear. If we were to break this word down, the staped, or the S-T-A-P-E-D, means stapes, that middle ear bone. And then ectomy is referring to, again, surgical removal. Also within our middle ear, we have a procedure referred to as the tympanoplasty, and this would be surgical correction of a damaged middle ear, either to cure those chronic inflammations or to restore the functioning itself. If we were to break this term down, tympano means eardrum and plasty means surgical repair. Let's take a look at the inner ear now. We have a labyrinthectomy, and this would be the surgical removal of all or a portion of the labyrinth. Labyrinth is easy to remember because the combining form is the same. And then we have the suffix of ectomy, which means that surgical removal. So this procedure is performed to relieve any uncontrolled vertigo. We also have the VRT, which is an abbreviation for vestibular rehabilitation therapy. And this would be a form of physical therapy that's designed to treat many different conditions of balance disorders, and the majority of which would be caused by problems of our inner ear and that vestibular nerve. Breaking down this word, vestibule means entrance, and then the AR, the suffix, means pertaining to. There are also treatments to correct hearing loss, one being an ALD, which is the abbreviation for Assisted Listening Device. Now, the ALD transmits, processes, or amplifies sound, and it can be used with or without a hearing aid. Now, an ALD can be helpful because it eliminates any distracting background noises. We also have the cochlear implant, and this would be an electronic device that bypasses our damaged portions of the ear and directly begins to stimulate our auditory nerve. Now, the external speech processor will capture the sound and then convert it into digital signals. And then we have fenestration, which would be a surgical procedure in which there's a new opening created in the labyrinth, and this is done to restore any hearing loss. Fenestra means window, and the suffix of tion, shun, means the process of. Another form of treatment for hearing loss would be hearing aids, and these would be those electronic devices that are worn to correct hearing loss. Now we have different types. We have analog hearing aids, and then we have a digital hearing aid. Analog is an external electronic device that uses a microphone to detect and then amplify those sounds, whereas a digital hearing aid would use a computer chip to convert the incoming sound into a code that can then be filtered before it's amplified. Now, this is designed to best compensate for a specific type of hearing loss. Any hearing aid technology that's advanced, you'll see it can be programmable using either a smartphone or a tablet. In today's lecture, we've discussed different treatment options available to those experiencing hear loss as well as different auditory disorders. I'm wishing you good luck this week with your studies.